Hello and welcome to today's video. Today we are going to talk about abnormal menstrual bleeding. So this is a very important topic to women because menstrual bleeding is what affects women, most women, almost every month. And there are women who suffer quite a bit from the issues of menses. Sometimes it's maybe heavy, sometimes it's irregular, sometimes it's things that are to do with pain. So today we are just going to look at abnormal menstrual bleeding. So with that, we are going to begin with definitions. And one of the definitions we are going to look at is the normal menstrual bleeding. So what is normal menstrual bleeding? Normal menstrual bleeding is a period that generally comes every month. And the total number of days is between 24 days to 38 days. And by this, I'm counting from the first day that someone sees blood to the last day just before you see your next blood again for the period, for the next cycle. So counting from day one all the way to the day just before another day one of your next menses, that is your cycle length. And the normal cycle length for a regular period is between 24 days to 38 days. So anything that falls out of that bracket is considered abnormal. One of the other things that we look at also when describing what is normal and what is abnormal is the volume of the blood that you lose. So generally, objectively, we say it should be less than 80 mLs. And that is like maybe 4 teaspoons or maybe 5 teaspoons, not teaspoons, tablespoons of blood for the entire duration of your menses. I know this may seem like maybe it's too little, but actually what soaks your pad is not too much. It's just a little blood that makes it, spread out, and it looks like it might be heavy, but it's not really too heavy. So normal is up to 8 mLs, but that has sort of changed. And these days we say anything that is, for the woman, it feels like it's too much, it's considered abnormal. So if you feel like your bleeding is excessive, you're getting things like anemia, lightheadedness, a lot of headaches, dizziness, feeling very weak, or your heart is racing during the time for your period, and you feel relatively that it might be heavy for you, it actually might be heavy for you. So we don't really do the objective measurement of 80 mLs. It is just subjective depending on how you perceive yourself as a lady, that if you consider your bleeding is heavy, it probably might be heavy. So you just run it by your doctor to clarify that. Okay, and then the other thing that we also look at is the duration of the flow. So the normal duration should be less than 8 days, and anything beyond 8 days, we say it's prolonged bleeding, which is of course abnormal. Okay, and the other thing is that we look at how often you bleed in terms of, do you bleed in between your period, or is it from one cycle to the next cycle to the next cycle? So if you have episodes where you bleed in between your periods, or you bleed after sexual intercourse, or after moving in a bumpy road, sometimes people bleed on a bumpy road. If they have issues, then that is a problem. It is not normal. So we're going to look at the causes of abnormal uterine bleeding or abnormal menstrual bleeding. And commonly, there is a checklist, as sort of a obstetrician gynecologists we go through to just try and understand what could be the possible cause of your bleeding even before we investigate, because that can also help us tailor the investigation the right way. So one of the things that is common is something called a polyp. A polyp is just a small growth, very innocent, that grows in the inner lining of the womb or sometimes in the cervix. And because it's in the inner lining, which is usually shed during your menses, it sort of interferes with the mechanics of that, and it leads to bleeding. That happens. And most of the time, a polyp is one of the reasons why you may have bleeding in between your period, what we call intermenstrual bleeding. The other one is adenomyosis. Adenomyosis is a condition where the inner lining cells of the womb, they go into the muscle of the uterus, and because of that, they cause some changes that also affect the mechanics of stopping and starting menses, and this leads to heavy bleeding, and it's one of the reasons why you may have either very heavy bleeding or prolonged bleeding. Okay, and the other one is fibroids. So fibroids is a common condition. Again, it's just a growth that occurs in the muscle of the uterus, and sometimes they occur in the inner lining, sometimes within the muscle itself or on the outer bit of the uterus. Sometimes there are many, sometimes it's just one, sometimes they're small, sometimes they're big. So the symptoms of fibroids depends with where they are located, and also the number and the size. And one of the common symptoms is that the pattern of your menses is not interrupted, but the period becomes very, very heavy, or they go for a very, very long time. And fibroid is one of the commonest reason why women have abnormal uterine bleeding or abnormal menstrual bleeding. The other one could be cancers. And cancers is one of the reasons why we say if you have abnormal bleeding, please just check with your doctor to make sure that there could be, if there is anything that is cancer related, it's caught in good time and you get help with that. And common cancers that can lead to that include cancer of the cervix or cancer of the uterus, and even some tumors in the ovaries. Sometimes they produce excessive hormones, and that can also cause abnormal bleeding, though that is rare. The common ones would be cervix and the uterus. So if you have, again, bleeding that is especially in between your menses, that is, intermenstrual bleeding, it could be related to cancer as well. Sometimes it could be because of the clotting factors. What clotting factors are the molecules in your body that take part or play a role in stopping bleeding if you maybe happen to bleed, or because of one reason or another. So sometimes if those molecules are not working well, again, it may lead to heavy menses. The other reason is it could be maybe because we are giving you medications that are making you bleed, and one of the medications sometimes is family planning medications or blood thinners that are given to people who have blood clot issues. The other thing, sometimes it could be because of hormonal problems. So if the hormones, the hormones in your brain, wait, let me take this back. Okay, so when you get your menses, the communication happens between your inner lining of the uterus, the ovaries, and the brain. So sometimes if there is any problem with that communication, it can cause you to have bleeding issues. And one of the seasons where this is very common is during the time for just, adolescent, when you have just begun your periods. That communication is not very mature, and you get a lot of regular problems of bleeding at this time as well. And also during the time just before you get into menopause, what we call perimenopause as well, this problem can be quite a lot, or people who exercise too much, or they lose a lot of weight, or they have abnormal weight, such as you're very underweight or you're overweight or obese. That can also lead to issues with that communication of hormones and lead to irregular periods. And sometimes we just don't have a reason, or sometimes it could be just the molecules in the inner lining of the uterus are not working well, and that could also lead to abnormal menstrual bleeding. So when you come to the doctor, we sort of look at all these potential causes and see what's likely the cause of the bleeding, and we sort of investigate to try and confirm it, and afterwards management really depends with what has been identified as the